Texas is making great strides in its efforts to vaccinate people against COVID-19. A quarter of all eligible Texans have gotten at least one shot. And across the Lone Star State, counties are ramping up their efforts, vaccinating thousands of people a day. And yet, in Austin, a city whose leaders brag about being the tech capital of Texas, people in groups 1A and 1B, the first allowed to get a shot, still aren't vaccinated. Not for a lack of want or trying, but because of a system that simply does not work. And I'm not talking about the technical difficulties that happened this week, though I'll say having people wait in line for 6 hours, desperately trying to get an appointment before you finally let them know your system is broken is unacceptable. But the way Austin Public Health has handled this distribution has long been botched. So many of you have reached out to me personally, to the station, expressing your frustration with not being able to make an appointment. And when you do, waiting in a line for hours to try to get your shot, sometimes with nowhere to sit or even a restroom to use. Meanwhile, other counties in Texas are practically begging people to come in and get shots. Their systems are simple and they work. You register online or over the phone, then you're contacted when it's time to make your appointment. And sometimes you can get in on the same day. There's no weekly free-for-all where a portal opens at a different time on certain days and you hope your randomly assigned position in line will garner you a slot. Seriously, who thought this was the best way to do this? And more, why are you still doing it this way? If people are emailing us about the problems, I know they're emailing city and county leaders. You need to act. Take a page from a neighboring county's book. Now, admitting the system you put in place is broken and finding a fix will take more work and it may be inconvenient. But what's far worse is leaving the elderly in our community vulnerable to this deadly virus because you're sticking with a system that is flawed. That's the last word.